This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone, and welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. Today's going to be a little bit different as you're just going to hear me talking. Most podcast hosts do that often. I am fortunate enough, I get a lot of good guests on here, and that's usually the way I prefer doing it, is just to interview them. But sometimes there's just topics I want to talk about, and today is one of them that I just feel like is long overdue. It's one that affects every single one of us, and that is health insurance. Sounds very exciting, doesn't it? But stick with me before you turn it off. What I'm going to share with you today could quite literally save you thousands of dollars every year, improve your healthcare experience, and possibly even extend your life. Yeah, bold claims, I know, but stick with me. So I'm titling this episode, Why Traditional Health Insurance is a Racket and What to Do Instead. So let's get into it. So let me just say this. Traditional health insurance is a racket. Unless you work for a large corporation that subsidizes your plan, chances are you're paying a ridiculous monthly premium. And what are you really getting? You're getting high premiums, high deductibles, high copays, and heaven forbid you actually use the insurance, you'll get caught in a web of prior authorizations, network limitations, surprise bills, and phone tree hell just trying to get a hold of somebody and get appointments. I'm sure we can all relate to that. So here's the kicker. These insurance companies don't care about your long-term health. Their business model isn't based on prevention. It's based on denying care, cutting costs, and maximizing profits. If you're somebody who tries to take care of yourself, which if you listen to this podcast, hopefully you are, if you exercise regularly, eat right, avoid unnecessary medications, you're subsidizing a system that rewards volume, not value. So it's a myth that you just have to have insurance. That's something I hear all the time. I have to have health insurance. And my answer is no, you do not have to have especially traditional health insurance. That's a myth. And it's a myth that's costing people their financial freedom and their health. There are way better options out there, especially, again, if you're relatively healthy and, not on 10 medications and you want a doctor who actually knows your name and remember stuff about you when you come in the second time and the third time. So the better way is, obviously I'm biased. I'm a direct primary care doctor, but direct primary care plus a catastrophic plan. And again, I get asked this a lot, and so that's why I'm kind of putting all this information out there. So this setup, direct primary care with a catastrophic plan, gives you the everyday care you need, prevention, urgent care access, and then a safety net, which is the catastrophic plan for the big stuff. So let's break this down a little bit more. Many of those who listen to me probably know what direct primary care is. We call it DPC for short. It's been a long time, actually, since I've done an episode about that. So let me just talk about that a little bit more. So direct primary care is a model where you pay your doctor a flat monthly fee. In exchange, you get unlimited office visits, which can be in-office or virtual visits. You get same-day or next-day appointments. You get typically longer appointments. For me, for new patients, I allow 1 hour. You can text anytime. You have phone access directly to your doctor. This could be evenings, weekends, even if you're on vacation. I had somebody not too long ago that was in a different state on vacation. They got sick. We did a virtual call. I called in a medication for them at a local pharmacy. So you also get personalized proactive care, not just 5-minute assembly line visits. And then at my clinic, so that's kind of the foundation of what I do in direct primary care, but then that model also allows me to do things I'm passionate about, like wellness, trying to get people off medications, hormone optimization, preventative care, weight loss, and then I do other fun things like ozone therapy and IVs and stuff like that you just can't really do in a more corporate medicine setting. So we're not billing insurance. We work for you, not an insurance company. And it's really the healthcare you thought you were getting all along, but better. And when you pair that with some type of catastrophic coverage, that's kind of the ideal scenario, because what happens if we can take care of a lot of things, but what happens if you're in a car wreck and you have to be put in the ICU for a month? Well, obviously that's where the catastrophic comes in. So doing it this way, you're not paying for all the fluff. You're covering, you're not covering specialist visits, prescription meds for 100 conditions you don't have. You're simply protecting against financial ruin, and it's affordable, it's simple, and it complements direct primary care beautifully. And so there's different catastrophic plans out there. What I like are health shares. And so health shares is not really insurance. These are nonprofit, member-based, cost-sharing groups. And so how this works is you pay your monthly share, whatever that may be, and that obviously depends on if you're covering for just an individual, for a whole family. Then a lot of times you'll have a deductible, like with me, it's $1,500. And then if we meet that deductible with something, then they'll cover 90%. In my particular plan, you can get them to cover 100%. And what I like about these is they're much more personal. So every month when I pay my share, I'm not writing a check to, Blue Cross or whatever. I'm writing it to the individual who filed a claim. So that individual will get a bunch of checks from, across the nation. And so it's just, and you can even write them a note, it's just much more personalized, as well as much more affordable. So some popular health shares are Samaritan Ministries, Christian Health Care Ministries, Sedera, Zion Health, MediShare, and I will put these in the show notes in case you're interested. And some of these are, can even couple with direct primary care, plans, because a lot of them, they see the benefit in adding the, a DPC membership to these plans. And so if that's something you're interested in, kind of check that out. So let's do the math. Say you're a healthy family of 4 and you're paying your monthly premium, which for 4 people, I'm going to guess is probably about $1,800. I mean, you're going to have a deductible of, it could be, anywhere from $5,000 or beyond. When you go in for an office visit, you're likely going to have a copay anywhere from $30 to $75. Especially, it could be more if you go to urgent care. You're going to have surprise bills that are very likely. I get told all the time, especially when it comes to imaging, that, say for an MRI, they pay all this money with insurance, and then when they go to get an MRI, their part is like $500. Well, guess how much an MRI costs when you're paying cash? $300. That's what I can get it for. So that's just an example of when you take out all the middle people and you're not going the traditional healthcare route, things really aren't that expensive. So with those numbers that I just gave you, a family is paying over $20,000 a year, only to wait sometimes 6 weeks to see their doctor. You get in for a 5-minute visit. Once again, it's a racket. So let's contrast that to a health share plan with a direct primary care doctor. So direct primary care, I'm going to say on average, you're going to pay $99 a month. That's for adults. Often it's less for kids. A health share plan for a whole family of 4, you're likely going to pay I'm going to say $350. And so there's no copays, no deductible for day-to-day care. And so with all that, not only are you saving money, you're going to have direct access to your doctor, same-day visits, telemedicine, personalized relationship with your doctor, and all for a whole lot less money. So, and again, what about emergencies? As I mentioned, if you're in a car accident, that's where the catastrophic kicks in, and you're covered. So I want to talk for a minute about, if you do this model, like how direct primary care improves your health. So in a DPC model, we have a lot more time. I was in the corporate model for many, many years, and so I can speak from experience from this. But I didn't have much time, and that's actually why I left, because I really got interested in getting people better, and I didn't have time to do that. And I have time now. We have time to really get a good medical history and get to the root cause of your symptoms and really optimize your health, try to get you off medications. Regular doctors are not motivated to do that. I'm sorry, they're just not. Not only are they probably not motivated, but they don't have time. So that's just the way it is. We can focus on prevention, not just prescriptions. Now, I will say there are many direct primary care doctors that just left the kind of the corporate world, and they still kind of practice traditionally. They're just doing it in more of a cash-based model. So just because a doctor is in a DPC model doesn't mean, they're doing all this and they still could be pill pushers. But there are many that just got frustrated with the regular system, and you're much more likely to find a more wellness-based doctor in a DPC setting than you would in a corporate setting. But for me personally, that's why I practice in this model, so that I can do all these things. I can focus on prevention, not just prescriptions. I can optimize your hormones. We can talk about nutrition. We can talk about sleep. We can talk about exercise. We can talk about how to keep you well, not just managing disease. So it's about saving you money, but it's also about getting better care and staying healthy longer. So just think about, because I think about this a lot, what if most people did this kind of thing, and they weren't stuck in that, quote, sick model of healthcare that I talk about all the time, where they're just put on medicine and sent to specialist after specialist, and the specialists put them on more medication, they have more tests, but they never get any better. I mean, I've seen this all the time, and they just stay in this sick model. So what if everybody could get out of that and really be focused on prevention and wellness, and how much healthier we would be? So a long way from that, but that's kind of my goal, I guess, and my dream. So it's really what healthcare should look like. So imagine this. I mean, you text your doctor and get a response that day. I mean, if you're not in a direct primary care model, you've probably that's foreign to you, but that happens. You don't have to sit in a waiting room for an hour. At my office, you're going to come in and my dog's going to greet you. And you're petting my dog, if you even have to wait at all. And so you also actually have a relationship with your provider. He or she, knows who you are, and the cost of everything up front. There's no mystery bills. So that's direct primary care. It's simple. It's transparent. It's patient-centered. And frankly, it's how medicine used to be before insurance companies got in the way. So, who this is not for, I mean, if you have, severe, chronic illnesses that, require a lot of specialists and require, just specialty care, may not be for you. If you're Medicare age, now I do see some Medicare people that just because they like the way that I practice, but, obviously Medicare pays for a lot of things. So, this, what I'm talking about with a health share and a DPC, may not be for you. So it's not for everybody. But the majority of people could definitely benefit from this. Also mentioned a little bit, this style of practice allows me to do some different things, such as hormones and weight loss, and other things I do are IV therapies, including like ozone therapy, vitamin C, and I'm not going to get into all those today, but this style of practice allows me to do, some of those different things. So kind of final thoughts is, traditional insurance is overpriced, inefficient, and broken. I do feel like there's a better way. You don't have to be stuck in the system with something like direct primary care plus a health share or some other type of a catastrophic plan. You can actually take control of your health care. You can save money and actually get the kind of health care you deserve. So, if you know somebody who would benefit from this information, send it to them. If you are local here in Oklahoma, definitely the greater Oklahoma City area, and you're interested in this, you could certainly chat with us more. You can find out more information about me at fitrxwellnessok.com. And short episode today, but again, I get asked this question a lot about health insurance, and so I just wanted to take a minute to kind of talk about it and give you my thoughts. So thanks everyone for listening, and we will talk to you next time and likely have a more traditional episode. So thanks. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.